Dr. Bhandari, thanks for taking the time to do this interview. Why don't you start by telling us how you ended up here at UT and why you're still here, what keeps you here at our institution?
Absolutely. Thank you for having me, Dr. Swales. So, I came to Houston 9 years ago for medical school and have been here ever since. Um, I initially was attracted by, this is the biggest medical center in the entire world, and that comes with so much. So that's what initially attracted me here. The training that comes with that must be fantastic. The subspecialty care, the opportunities. There's so much. There's so many incredible minds concentrated in Houston in the medical center. So just by virtue of being in that medical center, I thought this residency would have so much to offer. But then I came here and there's so much more. I fell in love with the people and the places and the experiences I've had here. They've been truly wonderful. And I mean, a testament to that would be I've been here for 9 years and don't plan on leaving anytime soon. So I think that's probably the highest of accolades I could give Houston. Um, do you want me to do you want me to move on? Do you want me to
No, that's perfect. I mean, I'm glad you're not planning on moving on, obviously, since I worked hard to recruit you last year.
I mean, do you want me to expound on some of these things?
Well, why don't we start? You are one of our recent graduates. And so I would love to know, looking back on your residency, what are the things that you most remember? What are the things that you kind of treasure looking back on it? I think sometimes it's hard for applicants to think about what they would, really enjoy about residency or picture themselves as a resident here at UT.
I think the thing that I truly treasured the most about my residency was the camaraderie, the absolute camaraderie that we created during my time here. Starting off as an intern, trying to figure out how to be a doctor and taking our first steps in physicianhood, and having a group of people doing the same, a group of people who were kind and caring, and were looking out for each other every step of the way. So I knew when I was struggling on my first days, figuring out how to, survive on the wards, I had this incredible group of people who were doing the same, but also looking out for each other. It meant so much to me. And then, progressing with that group and making it through every obstacle and hurdle that was thrown at us was so meaningful. And I know there are wonderful people around the country, around the world. This is my group, and I think this what I found here has been fantastic.
And then talk to me a little bit about the clinical opportunities here. We have a bunch of different hospitals. What comes to mind when you think about each of them, and what did they offer you as a part of your training?
Absolutely. So there is everything here. I feel like if you want to see it, if you want to do it, if you want to be exposed to it, you can find it here in the medical center, absolutely. And you can find great opportunities here. So we have so much subspecialty care, top tier subspecialty care, and I won't even go into that because I think we have a lot of people who can speak higher to that than I can. But about our hospital, so um, there are a few major sites, three major sites that we rotate at, four major sites that we rotate at, and let me talk about each one of those, and I'll tell you what I gleaned from the three that I rotated at. Um, so starting with Memorial Hermann. Um, this is our top tier hospital in the medical center where we have really some of the best subspecialty care and acuity, some of the highest acuity patients, um, probably in the state, even in some regards around the country. We have patients coming here from wide swaths of the the south of the U.S. These patients are so uh, need so much high level care that you learn so much. You see such rare pathology, and that really is vital for a trainee to see such a variety of very sick patients to learn from. And I think we get that at Herman very, very well. Um, we have, I think our cardiology and GI programs are some of are some of the most incredible programs that um, I, I've ever heard of. So I think just by being near them, I've learned so much, almost vicariously through them. Our next location I want to talk about is LBJ, and this is, I think, the lifeblood of our program. This is our county hospital that uh, primarily takes care of indigent patients and uninsured patients who, you know, are lacking a lot of healthcare because there's not many resources that can provide healthcare for them. It's in a location of Houston that um, doesn't have a lot of healthcare resources, and this hospital is run almost entirely by residents. It could not function without residents. And when I was a resident there rotating, I truly felt that I had ownership of this place and these patients, and I felt that the care I was giving was very meaningful and brought me so much satisfaction. And I currently, as I transitioned to faculty, that's actually the location I fell in love with. So I base all of my care out there at LBJ now. But that type of care, for me, was so meaningful, and I've learned so much from these patients. And the types of pathology you see are astounding. And every day I'm seeing something new and learning so much more from my patients there. And the last location I would like to talk about is MD Anderson, which, as I think, its name does precede it, it does give some of the best cancer care in the entire world. And we have patients coming to MD Anderson from literally all the corners of the globe. And the learning that goes on there um, is definitely extremely valuable to see that type of care as well, and does augment our training as residents.
So a lot of times people talk about, as they're making their residency decision, this balance between like teaching and supervision and autonomy, and then general medicine and subspecialty medicine. As you think of those continua, where would you put our program? I mean, how would you put us on those scales?
Could you repeat that question for me, Dr. Swells?
Sure. A lot of people, when they're on the interview trail, are trying to figure out where different programs sit between, a lot of autonomy and a lot of teaching or a lot of supervision, right? And I'm curious if you think you can put us on that scale, or if you think different institutions are at different places on that scale, or maybe it just doesn't apply to us. And then similarly, there's a different scale, I think, where people think about how much does this program focus on general medicine versus subspecialty medicine. And I'm curious, those are two different questions, but I would love it. I think our applicants would benefit if you could talk about it.
Absolutely, such a good question. So that's the balance we're all searching for, right? That balance between autonomy, giving residents autonomy so they can be, fully functional physicians out in the world, but also supporting them as they go through residency, and they don't feel lost or like they're falling through it. And I really think that our program has hit a balance. Obviously it's constantly changing, and depending on which team and where you are, and what the current zeitgeist is in the program. But uh, I truly think, on average, the program has such a good balance between um, allowing the residents to take control, to lead the care of their patients, to make their own decisions without being, without having a paternalistic told what to do about it. But at the same time, if anything, if they do have any questions or feel like they need a little bit of guidance, we have it right there, and it's always there. And I mean, just I think examples or yeah, I think examples speak so much louder. So at LBJ, our faculty are so my training at LBJ was, I think, really did prove exactly that point. The faculty are so knowledgeable, and um, these, in my mind, these like Olympian figures in the pantheon, and they could do anything, but they allowed the residents to make decisions and, fully control the care of their patients. And then when the residents, did have questions about, these higher level things that sometimes don't have correct answers, the attendings would, have a discussion, not even, telling them what to do, but have a discussion with the residents and, guide the team to, where the patient care would ultimately go. And I thought that was the perfect balance between the autonomy and the support that every program tries to achieve. And then as far as general medicine versus subspecialty medicine, um, I, ooh, I, so I personally want to go into general medicine, and this is kind of my goal. I'm not planning on specializing. That being said, I am the kind of person who wants to know a lot about everything, and I want to continue to learn expand my knowledge in all of the subspecialties and I think that'll make me a better general practitioner. And I think that's what our program does. I think we have such incredible subspecialty care and so many incredible doctors to learn from that our residents learn such detailed and nuanced care in the subspecialties, which they bring back to their general medicine. So then our general medicine rotations and their training, they are drawing from all of these spaces and giving such high level of care to our patients. It's amazing. When I'm in clinic, the my residents will be citing new studies and even changing my clinical management because I'm learning from them, and they're constantly learning and sharing that knowledge with everyone. And I think that kind of educational atmosphere has really lent itself to to growing here.
Totally agree with you. I learned so much from our residents. I'm constantly impressed by them. All right, one more question. So tell me about your favorite things to do in Houston. What will our applicants find, if they aren't familiar with it, to do in this city?
Okay, so I know everyone always says food, and I'm probably the biggest foodie we have here. I love all of the Houston restaurants, and I have a list of probably 50 to 100 restaurants I still need to try. They're constantly popping up, and I strongly believe Houston has the best food scene in the entire country, and I will defend that. Uh, but, you know, I think a lot of people focus on the food and they don't mention a lot of the other really incredible things that Houston has to offer. I've been here for 9 years and I keep finding more and more things that I love about Houston. The green space in Houston is something that no one talks about, but is absolutely fantastic. We're one of the greenest metropolitan areas in the entire country. Our parks are gorgeous. They have lakes and land bridges and just enormous green spaces full of trees that make you truly feel like you're in the wilderness, and it's really wonderful. I think, again, stories I think speak a little louder. So I want to tell you about a perfect day I had here in Houston. A group of friends and I went to start in the morning on a Saturday, and we went to Eleanor Tinsley Park, and it's this beautiful green space. Lots of people out playing volleyball with their dogs, and we played frisbee, hung out. Um, we set out some blankets and chatted on the green while with this beautiful view of downtown right there. It's just gorgeous, towering over you. And then we walked over and rented 4 tandem bikes and then rode around Houston, around the Heights, and just, stopped wherever we wanted to, rode along the bayous, and it was just the most gorgeous day. And then we, went to a coffee shop, got some coffee, and we finally ended it riding around Houston uh, at Onion Creek Cafe in the Heights and had brunch. And for me, that was just a perfect day full of, just adventure and spontaneity and, some of the things that Houston has to offer. And to me, that's what Houston, that's the feeling that Houston gives me. It's just wonderful.
Totally agree. That sounds adorable. So, do you enjoy tandem biking, Karthik? Because I've heard it's not as great in actuality as it is in appearance.
So I love tandem biking. I had never done it before that day, and it is a lot of fun. It requires so much coordination and teamwork. And if you are not perfectly in sync, you are falling off.
Yeah, that's what I've heard. So it sounds like you and your partner were very much in sync. Congratulations to you. Thank you so much for your time. I really appreciate it. And thank you also for staying here for 9 years. I know we are all much better because of your choice to be here with us. So thank
Thank
you.
you so much, Dr. Swales.